Hi, good morning again. Let's start with the global and Asian context. In 2022, lung cancer is a leading cause of death and incidents. And let's see, the major burden happen is occur in Asia, like as 63.1 occur in newly diagnosed lung cancer and 62.9 lung cancer death. This slide shows the regional variation. Let's see, this you can see the highest incidence of lung cancer is highest in the Eastern Asian and is the highest for all over the world. And among during Asian region together, the second highest is Western Asian and then Southeastern and then South Central Asia. It's also in male and female pattern. And when look at the country, Asian country, this for men, the incidence is lung cancer place number one, the first rank in 19 country in Asia, and rank the first death, highest mortality in 31 country in Asia. For women, can see is also ranked the first in China and North Korea, and also the first ranked the first in mortality as well. When look at the trend of lung cancer during 1990 to 2019, when you can see for the overall here from male, this yellow is for overall, the global. The trend for men is lower all incident and death. But when look at the trend, when look at the subgroup, for the middle is slightly is increased. That's most of country in Asia is like a middle SDI. When look then move to the female, the overall trend globally and all subgroup is also increasing in female. Now look and also the problem in Asia, we are concerned about the growing concern of lung cancer in never smoker. As you can see that compared to the smoking prevalence of lung cancer patients in Asian and Western region, for America and European country, most of them are caused by smoking, but in Asian country, we have less smoking, particularly in female, that you can see that never smoking in women exceeds 60% and is ranked from 60 to 95%. When look at the age, at diagnosis of lung cancer between never smoker and smoker, this is from like a meta-analysis from low-dose CT screening among general population. Most of the study is like a 40 years old, and mostly in Asia, and have one from I-ELCAP multi-cohort. I'll show that the never smoker have the lower age at diagnosis and is around 2 years younger. Then when look at the risk factor of lung cancer in Asia, this is for men. You can see that number one mostly from smoking, and number two and number three from number two mostly from ambient PM 2.5, and also have some households pollution from solid fuel. When look at the female, can see that most number one is still smoking, but there are some part that ambient PM pollution is the first is like in Central and South Asia. And you can see the third one, this is like for in-house households PM. Next, when look at what happened about the race, ethnic, and gender difference have this is a meta-analysis about the general population as well that from the same set of lodosity screening in general population. From this, we can see that we can see for Asian people, smoking and never smoke, can see the risk is no different. But when look at the non-Asian, you can see the smoker non-Asian have a 4.5 times higher than never smoker. Next, to see compare between female and male. When look at the ever smoker, when ever smoker, you can see male and female no difference. But in never smoker, we see that women have like a 70% higher than men, never smoker. This is for Asian, only for Asian population. That's mostly from East Asian. And also when look at female never smoker compared to ever smoker, that no specific pack year or even say at least 30 pack year, there are no difference between the risk ratio. And next, move to the genetic feature of lung cancer in Asia. You can see the EGFR mutation, the prevalence is very, and mostly is highest in Philippines and Thailand, and also high between East Asia and Southeast Asia. In India, it's just around 30%. And the prevalence of EGFR mutation is higher in non-smoker. And the prevalence of KRAS mutation is lower than Western country, it's around 8 to 12. And most common KRAS mutation is G12C. And challenges in lung cancer control in Asia is a late-stage diagnosis is common and limited accessible to low-dose CT screening, molecular testing, targeted therapy, and also economic limitation and lack of government program for widespread screening. High prevalence of TB that can cause misdiagnosis and false positive, and underestimation of true burden of lung cancer because many countries lack of cancer registry system. In conclusion, lung cancer represent a substantial and evolving health burden in Asia, characterized by high incidence and mortality rate, have a regional variation, a significant proportion of cases in never smoker, and smoking remain a predominant risk factor for lung cancer across most regions for men, but ambient particulate matter pollution emerges as a leading risk factor for women in Central and South Asia. Thank you very much.